Because it's time for the King Clinic. It's Dr. Jeff King. And today, I understand, dealer's choice.
That's right.
Potluck,
Potluck.
potpourri, or whatever.
Sure.
So I have questions. I always have questions. So we've talked, you've been on with us for how many months now?
3 or 4.
More than that, I think.
Maybe longer.
I'm just saying we've covered a lot of topics in terms of chiropractic medicine, so I'm going to ask all kinds of questions. The first one being, what would surprise people the most to hear that you can alleviate symptoms of or pain surrounding? Because, you know, I just want to say...
Well,
I want you to think about it because you've taught us about... The thing that was most amazing to me was, like, helping children with bedwetting and colic. To me, that's amazing that you would never associate, the layman would never associate chiropractic medicine with curing those kinds of things.
Sure. Well, probably... actually, it's kind of age group dependent. I found that in the maturing population, they're very surprised when they hear that their arthritis can be helped to a great degree, where it can be halted and in some cases reversed. Almost every time I throw up their films, I go, well, look at this, look at that. That's a decaying joint. And they'll immediately interrupt me saying, well, nothing can be done right. Instantly. It's like a knee-jerk reaction. No, that's not what I'm saying at all. And I go through, even still sometimes that folks don't believe it.
Well, I didn't realize, actually, I thought you were just relieving some of the pain associated.
Sure.
You're actually stopping the advancement of arthritis?
Yeah, in many cases.
And how? How are you doing that?
Well, an adjustment, as far as the spine is concerned, is a controlled exercise of joints. Ultimately, that's what an adjustment is in a mechanical sense. Looking at destroyed joint tissue. We exercise it through time, through adjustments, and eventually it begins to move on its own. You see, the whole kit and caboodle started with joints not moving. Joints don't move, as I forgot who the researchers were. I was very ill-prepared today. But ultimately, they fused the spines of dogs for a while, just to see what would happen, okay? And in 6 months' time, they took a look at these dogs, and they found that the discs between the bones, you know, the cartilage bumper cushions, decayed, started to collapse. Total derangement, arthritis set in within 6 months. So that's where the researchers said, okay, well, this must be the process then of how arthritis can begin. Joints that don't move, stiffness, this kind of idea. So chiropractic moves stiff joints around and stops that process. And we always take x-rays often when it's necessary in the beginning and then at the end. And every time we see changes.
That's interesting.
And people are always shocked. Wow.
Now, it's interesting for those that haven't stepped into a chiropractic office or your office specifically, what are some of the things that they should be aware of? Because you obviously, to do what you're doing, you use different things besides just your hands. I mean, there are other tools involved.
Sure. It's practitioner dependent, ultimately. I think previously we mentioned something along the lines of about 200 approaches to mechanical problems in the body. Any problem of the bones, muscles, nerves, and joints is chiropractic, ultimately. Many times people think back. Well, it's also shoulders. I handle a lot of shoulder problems and tennis elbow, and have a lot of athletes. I don't know why, I just attract them. And that seems to be my focus. So if you have an ache or a pain in your body that's worsening or just doesn't seem to go away through a long period of time, that's time to consult a good chiropractor, not necessarily just a back ouchie.
So back and shoulders would be, no, I want to change this. What is the joint or area of the body that takes the most pressure or stress that can sort of give out on you?
Great question. The low back is the Achilles heel of the spine. It tends to take the most abuse. Because
you bend from there?
Yeah. It's near the center of gravity. So it takes a lot of whipping through your life. And it tends to, the way it's structured, for example, the nerve roots, you know, you have bones of the spine, and the spinal cord goes through it, and nerves come out between the bones, right? Well, down in the lumbar spine, right at the bottom, the hole for those nerves to exit is the smallest, and the nerve roots are the biggest.
Wow.
So it's very sensitive, and it can be disrupted very easily. That's why people, you hear people have problems with their low back all the time. In fact, 80% of the population in their lifetime will have low back problems that are really significant. So.
Is there anything you can do about Blood clots?
Nope. No way. Got to see the MD for that, for sure.
An MD.
You know how, because blood clots usually start in the legs or whatever, and then they break off or move up, or...
Yeah, that's a bad scene. That's an emergency.
And that has to do with circulation?
Yeah. Yep. Circulation's poor. Now, chiropractic can affect the circulation, but by the time that you got a clot forming, that's a bad problem for a while, or a complication of surgery, or something like that.
What about cancer patients? Is there anything you can do to help?
I have cancer patients sometimes that present in my office. As long as it's not actively growing, then something can be done. Because, as you remember, chiropractic affects immunity.
All right.
It increases circulating CD4 by 66, 63%, which is a component of immunity, which is really significant. It helps people that are immunocompromised, which of course cancer patients are.
So they'd have to be in remission?
In remission or under active treatment, for sure. But if it's actively growing and you're resistant to allopathic methods, chemotherapy, radiation, no way. Because it's on the spread, and
you could actually help it spread more? Oh, I see.
Wow, that's scary stuff.
Because you're opening up this, or you're making the
things,
system work correctly, and it's going to carry it faster.
Exactly.
But I think that's interesting, too. It's not always an either-or proposition. I mean, all types of medicines or approaches to healing can be complementary.
Absolutely.
And you just said, I mean, often maybe working with an oncologist and the chiropractor at the same time.
All the time.
That's great.
We do that all the time.
Okay, I'd like to also go back to women who are pregnant. During various stages of their pregnancy, I know that you can help them actually prepare the birth canal or prepare their lower region for facilitating that birth a little easier?
Yes, we balance the pelvis primarily. Most commonly, pregnant people are struggling with their low backs, getting up and down. They're always grabbing their
lower back.
And back labor. What is back labor exactly from a chiropractor's point of view?
Back labor, that means that back's been stressed out a long time. It's all facilitated, and that's a trauma anyways, having a baby. So, of course.
For mom and the baby.
Yeah, for everybody.
Everybody involved, yeah.
Yeah, it's a big trauma. So it just reflexes back in the spine to what's already hurting, just magnifies it.
It's amazing.
Yeah.
Now, listen, this is MDA week, thinking of children. You know, we had little Morgan in town. We got the little angel with us that Morgan's parents and her presented us with. What are you doing? Because I hear good things about how you're being involved in MDA.
Well, I am going to the pokey for good.
He's never going to be in the studio again, Karen. We'll have to go there for our interview.
Going to the pokey for good. That's a good way to say it.
Yeah, I'm raising funds to help local kids with muscular dystrophy.
So you're going to be at jail in Krieger's. Won't be too bad if you're at Krieger's, right?
That's right.
Yeah,
good food.
Ones, right?
Yeah.
But now you're doing something kind of cool. If people come in for a visit or...
Well, my regular practice members and such, I haven't even announced it. I've just decided to do it. I was going to take a whole day's services, what's generated in the clinic, and then match it with my personal funds. And whatever that is, that's going to be my personal donation towards the cause.
That's great.
So have you established what day that will be?
Probably my least busy day. No, I'm just kidding. I'm just kidding.
It will be busy before
Sunday.
today's over.
It'll be Sunday.
Maybe Sunday, I'm not even there. No, it'll probably be a Friday. Busy
All
day.
right.
But
Yes, you are going to be in jail on Thursday as part of the lockup, and you're asking people to help bail you out, and that money goes to MDA.
Yes.
See how much people like you that day. That's what we'll find out.
So,
Yeah, right.
they can come to Krieger's, or they can call the office to make a pledge, or.
Sure. We have a donation sheet and sign up. Tax deductible, of course.
So tell us where you're located, your phone number, your web address, all that good stuff.
Okay. Email address is kingclinic@aol.com. The phone number of the clinic is 641-0644.
All right.
There you go.
There we have it.
Very good. Thank you so much.